Good afternoon, everyone, and thank you so much for joining us today for today's KAC featured webinar presentation, which is Kansas County reimbursement for state hospital wait times. And today with us, we have the KDADS Deputy Secretary for Hospitals and Facilities, Scott Bruner, with us to present on this very important topic. And so, Scott, with that, I am going to turn the microphone over to you. I will say, Scott, that we'd ask for everybody to type their questions in the Q&A box.
Okay.
And then we can answer them as you're going along, or we can wait till the end. So whatever you prefer. So it's your floor.
Okay, thank you. Thanks for the opportunity and the invitation to present. Done this a couple times already for the Sheriff's Association and law enforcement, and another time with the Hospital Association. So if you've seen any of those, it'll sound pretty familiar, which is probably the goal, to be consistent. So have added a little bit that we've learned over the last couple of weeks. So again, thanks for the opportunity. I can see the chat window, so I'll try to keep an eye on that one too. If there's a particular question that comes up about something that I'm talking about at the time, so I can pause and do that. But again, thanks for the opportunity. My name's Scott Bruner. I'm the Deputy Secretary for Hospitals and Facilities at KDADS, and am kind of have taken responsibility for implementing these two reimbursement programs that we were charged with by the legislature in the last session. We're excited to do it. New processes are a challenge, and the state process for paying anybody anything is way more cumbersome than it needs to be. So we started early and are still a little bit behind where we wanted to be, so that we can get this funding out to counties and law enforcement and hospitals. But I did want to make sure we had enough processes in place that we would make fewer mistakes than more, and that's kind of where we've gotten to. But so what I'm going to do is talk through the two programs and try to highlight how they're different for your purposes as the Association of Counties, and not 100% sure what everybody's role is. And if it doesn't exactly apply to something that you do, just try to find the meaning or ask a clarifying question. But I am going to cover both. And then I do want to walk through one of the forms that we created, which I think is a good example of the kind of information we're going to ask for to be able to do the reimbursement. And some of the mechanics are the same for both programs. So I think that'll help clarify what we're looking for. And then at the end, kind of say, how does all this come together in terms of you all getting paid, or counties getting paid? So that's going to be the goal. So the first program is in Senate Bill 228 from the last legislative session, and it directs, there's a lot of other things going on in Senate Bill 228 about county jails and how they're structured and organized, but there's a section that has this reimbursement program described that directs KDADS to reimburse counties for costs related to holding a person in custody while awaiting examination, evaluation, or treatment for competency to stand trial. So this is the part of our statutes in the state hospital program where we take criminal defendants who there's some question about whether they're competent to understand what's going on in their court process. The court decides that they need an evaluation completed of that defendant to see if they're competent to stand trial. And if they're not competent to stand trial, start the process of restoring them to competency so their criminal case can proceed. And all of that's done through a couple of different things, but primarily through our state hospital at Larned in the state security program. And sometimes, as you all well know, we've got a long wait time to get people into Larned because there's just not enough, more demand, not enough beds, that balance. And so this is an attempt to pay for jails or pay counties when they're holding those individuals in jails, but they're waiting for that competency treatment to be completed. There's a few other nuances to it that I'll highlight, but that's kind of the high points. The rate in the bill is $100 a day, and then it directs us to come up with a process to pay that on a quarterly basis. And so the form is driven kind of around a quarterly process. We can pay for every day a person's in custody and confined and waiting for waiting for competency. There's a question about juveniles. It's not clear to me that this would cover juveniles because they're not ordered to Larned for the competency, and that's the direction that we're given. I'm going to ignore the questions, but it's going to get confusing. So let me stay on the slide for just another minute. So we can pay the counties for every day a person's in custody and confined. That's an important distinction. So they've got to be ordered to Larned ordered for a competency evaluation or competency treatment, and they're inside the jail confined. So it's then the next two paragraphs kind of describe the time frame. So it's $100 a day. How many days do you get paid for? So it's from the day that the request is made for evaluation for that examination or evaluation. So that's the date that the court orders that defendant receive a competency evaluation. That's our start point. The end point is when they're taken from confinement in the county jail to wherever they're going to get that evaluation completed. And that might be Larned State Hospital. It might be Osawatomie State Hospital, because we do competency there as well. And we also do some mobile competency where the evaluator comes to the jail and performs the evaluation in the jail setting. And so for those, we'd look for the end date being when the competency report is filed with the court. So again, another date that is, we have a way of referencing. So it's from the date that report is submitted to the court. If somebody's waiting for competency treatment, then it's from the day that the person's ordered to treatment and they're waiting in jail. So they've either come back from Larned, they've been evaluated, they've come back to the jail with an order that says they're not competent, and until the court says they need to go back to Larned for that competency restoration, you'd start on the day they're back in your jail until they go to Larned, Osawatomie again, or it's the treatment's conducted mobily. So beginning date, end date, subtract the two times 100, that's the payment amount, is the basic mechanics of it. Juvenile detention. Well, we'll come back to that one. So a couple of the key points that are important to mention again, we're paying counties, so not jails directly, because we talked to law enforcement about that, but the sheriffs want to get this money directly. And I think universally we heard they work with counties control the money, county finances, who should get the money, and then the jails can work through the regular finance process. So the main part of that is that the county needs to be registered in SMART, which is the name of the state accounting system. And we checked, and we found 100 of the 105 counties, or 101 of the 105 counties in SMART that already are enrolled, registered, have a vendor ID number. So we are confident that that's something that counties know how to do. But that's critical because we don't have another way to write a check if it doesn't go through SMART. The types of competency examinations, evaluations, and treatments that we can reimburse for are the statutes that are listed there on the slide. The 3302 and 3303 are the kind of common evaluation and restoration statutes. The others that are on there are related to pre-sentence evaluation or treatment in lieu of confinement, all things that in the court order, when the court orders a defendant for any of these kind of competency actions, evaluations, or treatment, they specify which of those statutes are are the authority for ordering that person to Larned or Osawatomie. So you'll know that's information that'll be on the court order. And there are a few that aren't within those statutes but they're pretty minor, and we don't see a lot of cases of that. So those are the main ones. Again, they're based on the reimbursement. It is a reimbursement program, so you've got to have people in your county to claim the reimbursement. They've got to be in your custody and confined. So we did get some questions about, well, what if a defendant's out on bond, or there's an outpatient treatment order that's been done by the court? That doesn't meet the definition of being confined, so we wouldn't reimburse for those. But up until that point, when the person's released on bond or released on an outpatient treatment order, those would be days that are okay. They don't as neatly fall in the window that we're talking about, but got to be in custody in the jail. That's the main point. And then what we're also trying to do, so to make this as simple and straightforward as possible, is use reference or use dates that we can verify against information we have at Larned. So if a defendant's ordered to Larned for an evaluation or for treatment, we get this order as well. And so we'll have that copy of the court order with the dates on it and the date stamp. And so we can refer to that. So we talked about for a while, could we just tell counties how many days, how many defendants they have and how many days? But there are some nuances where we may not know that, and it's set up as a reimbursement program. So we are going to ask you for the information, but again, it's all stuff that we should be able to verify fairly easily. The other program is similar, but works on a different kind of statutory authority. So House Bill 2184 is the big budget bill that's passed every year. And one of those, there's a thing called a proviso where the legislature provides some statutory direction to agencies. And there's a proviso that covers this other program that directs us to reimburse healthcare providers, law enforcement, and other county entities for unpaid costs related to patient observation and transportation. And this applies specifically to patients that are waiting to be admitted to Larned State Hospital, Osawatomie State Hospital, or one of our state institutional alternative partners that are community hospitals for an involuntary care stay because they're a risk to themselves or others. So there's got to be a care and treatment case with an involuntary order from the court to Larned for a stay. But if that person's waiting in a hospital or waiting in not in a jail because they're not in custody, but maybe waiting with law enforcement in some other in the office or in the waiting room or exam room, that's who we're looking for in this. And there are other county entities, the mental health center, if as those are county run, that could be another party that could get paid. But somebody who's waiting for not a forensic stay in a state hospital, but involuntary commitment stay under the Care and Treatment Act. So the process is going to sound fairly similar because that Crisis Intervention Center is a good example, Bob. So if that's run by the county, that would be one of the, I think that's included in other county entities, which we have been trying to figure out how to define that term. But so again, we're define who we're paying: healthcare providers, primarily hospitals, law enforcement, other county entities. And any organization that we're going to pay through this mechanism needs to be registered in SMART. And we did not go through the process of trying to figure out whether every hospital that potentially could be holding somebody is in SMART. We don't know exactly how to define other county entities, so I don't know where to go look for that information in SMART the same way we did for counties, but that'll be a critical kind of threshold. If you're submitting a claim for reimbursement, we need to make sure you're in SMART, either by telling us what your vendor ID number is, or give you the forms so you can get registered as a vendor. And we've got all those forms, we've put them on the website, and we'll happy to share them. But that's kind of, you're not going to get a check until you're registered and enrolled in SMART. It directs us, the bill directs us to pay for unpaid costs and for certain types of providers. And it's only allowable within our state fiscal year that started on July 1, 2023 through the end of June 2024, because it's part of the budget bill. So if you had a patient before that was ordered to Larned on May 15th, and you've been holding them for, maybe still up to today, we can only reimburse back to July 1st, not all the way back to the original date. There's no rate established, so it would have been kind of in retrospect for the legislature to tell us what a reasonable rate was, but that didn't happen. So we've got a proposal of what we would like to pay for observation costs and transportation. There's $5 million appropriated. So when we spend $5 million, we'll stop. But so we're still working and negotiating on what that payment rate is, but I think we're pretty close. And I'll share that here in just a minute. And then we're going to reimburse for patients that are waiting for admission to Larned, Osawatomie, or a state institutional alternative provider. There are about 7 of those around the state that we work with as well. And again, those are all places where we know who's ordered there and who's been admitted and how long they've been our patient. So that's, again, something we can verify against information we've got on the campuses or working through some of our other partners. So what you're looking at now is a form. This is the one for the Senate Bill 228 law enforcement competency reimbursement that we created. This one's actually out on the KDADS website, and I'll show you that link here at the end of the presentation. But we moved a little faster on this one because we can go back and reimburse for a longer time period for law enforcement. We can actually, the law authorizes us to go back to July 1, 2022 for people that are waiting in law enforcement custody or did wait in law enforcement custody. So because we wanted to work through that almost 12 months of retroactive period, we wanted to get the form out a little faster than the other one. The rate was defined, the payer, who we're going to pay, was a little more defined. So it's a little easier to get this one built, but a lot of the mechanisms are going to be similar between the two programs. So I'm going to walk through some of the elements of this form and then try to crosswalk it between the two programs. There is a good question in the chat about how much funding there is for Senate Bill 228. There's no limit. So it's actually a demand transfer from the state general fund to KDADS for whatever costs we identify as needing to be reimbursed. So actually, if you're county folks, so you'll know what a demand transfer is. So that's an unusual thing for agencies. But so we will add up all the counties that request reimbursement over the course of a month or a quarter or some time period. We certify that amount to the budget director and the Division of Accounts and Reports. They send us money from the general fund to populate the fund created for the Senate Bill 228 purpose, and then we write checks. So there's no limit on that one, as opposed to the other program. So, but back to the form. So kind of highlighting the upper corner of the form, which is where we're trying to capture information about who's submitting for reimbursement. So requesting organization, or kind of that first step is on the Senate Bill 228 form. It asks about county, which county is requesting the reimbursement. This could be a hospital or a county for this purpose, but the idea is the same. The main fields that I do want to spend some time on is the Smart Supplier ID and the Smart Short Supplier Name. The supplier ID is a 5-digit number that the Division of Accounts and Reports assigns to everybody who's enrolled in SMART. It's a supplier ID or a vendor ID. And we want to make sure we're paying valid vendors in SMART and that we're paying counties where they want the money to go, because that supplier ID is tied to tax ID numbers and other bank accounts, things that are would help direct. If you've got multiple SMART IDs and some of them are for your property valuation area or some other function, we want to make sure the money gets to the right place. So that's an important field to fill in with the number that the county, where they want that money to go based on that supplier ID. Short supplier names, the same thing. It's a second field that's in SMART that helps narrow down if there's a discrepancy between a vendor ID and the SMART supplier name. It fails in the system, but you've got to put both in. So again, that's a number and then the name that is important to identify. For counties, when we look those up, it's the county name and a 3-digit number. I don't know what it would be for a hospital or something else, but those are two things that are in SMART that we would like you to tell us on the reimbursement form, so we know we're paying the right people or organization. The address is important as well, because there's an address assigned with that vendor ID as well, also, and we have to provide that on our reimbursement request that we put it into SMART to pay you. So the supplier ID, that short supplier name, and the address all have to match within that vendor vendor identification record. And those are all fields where you can enter the numbers that you, or the values that you want, so that they're right and accurate, and the money will go to the right place. If there's something that's missing, that'll create a delay in getting the payments out. We put something in there about a contact person and phone number, because if we have a problem or can't validate something, we'd like to have somebody to call to check. But that's pretty straightforward. But because it's all tied to SMART, getting the information that you know in SMART, or that you have from SMART, is helpful to us to tie it all out so the payment gets to the right place. We can look that up if there's a question or a problem. We've had that come up a couple times, or just people asking a question. We're happy to look that up, but I think if you know what your SMART ID, supplier ID, vendor ID number is, and supplier name, or you're active, are getting other payments from the state, it ought to be something that's pretty readily available. Law enforcement, honestly, when we talked to sheriffs directly and their teams, they were more confused about that, which could be a good thing, because they don't deal with the money side of things. We suggested talk to the county finance people that you work with and get that identified. So hopefully those conversations are happening. There's a question in the chat about how do you know what your supplier ID or supplier name is. If you're registered in SMART, if you're getting payments from the state, pretty much from anywhere, you've got a SMART ID in the system. You can check with the Division of Accounts and Reports. There may be an automated lookup, or if there's a question, when I'll give you an email address that we're monitor email box, we can look it up for you as well. But again, if you're getting any kind of payment from the state, that ought to be some values that you're that are pretty readily available. Time frame, we put on both of the forms kind of the year and month that you're requesting reimbursement for. That's mostly to help us track kind of so we don't duplicate and overlap payments. So that's on there as well. And then we get into the parts of the form that identify the individuals that are you're holding or have in care. So for the criminal, or for the Senate Bill 228 forensic cases, you should have the defendant's name. There should be a case number, a criminal case number. Those are things that we get from the court orders at Larned, no Sawatomie. So those are things we can verify. We are fairly confident they're unique. There may be multiple case numbers assigned to one defendant, but you're not holding them multiple times. So again, we think this is kind of a one-to-one, or pretty close to one-to-one association between the name and case number. So again, it's mostly for us so we can identify that we don't double pay you for the same person. So that's why we asked for those two fields. We thought about other birth dates and other kinds of things. We're not sure that that's needed. So we'll see if this gets us to the idea of identifying one person for one stay duration. For the forensic reimbursement program, we're going to ask you for the defendant's current location by county. So there are some counties that don't have their own jails. And so if they've got a defendant who's in custody waiting for competency, that defendant is actually in another county's jail. The case number is from their, let's say their home county or their resident county. Then of course the name's the same, but their physical location is not in the same county. That's fine. We still want to pay for those people. But as we talked about it, and with law enforcement, it made the most sense to reimburse the county where the criminal charge is, and through this program. And then that county can continue to pay the county jail where their defendant is being housed through whatever contractor mechanism they already have in place. And it just made the governance of it cleaner. I don't know that it was a universal opinion of law enforcement. It was the majority, and a pretty big majority of sheriffs that said, just pay the county where the criminal charge is, and we'll get the money to where the person's actually being housed. Example being like Ford County houses folks from several of the surrounding counties that have mental health issues. So if it's a defendant who's got a criminal case in Pawnee County that needs evaluation, but they can't support them or house them in the Pawnee County jail, that defendant's in Ford County. On this form, it'd be submitted by Pawnee County with the defendant's name, their Pawnee County case number, and their current location would be Ford County. That's also something we know at Larned for somebody who's been ordered to Larned for competency, that because when we say they're ready to be admitted or send them our way, we communicate that to the jail where they are, and the jail and the county where their criminal charge is. But that's something else we can verify. So that's the reason we ask for the county, and it could be different than the county that's submitting the reimbursement form. And then the last comment about the defendant's name. So you could have a person who's ordered for evaluation, and then that's complete. And then they're ordered for competency restoration, and that's complete. And if it happens in the same time period, that defendant would show up as two rows on the form, because we want to account for both of those wait times. The case number might be the same. But anyway, so we would expect that there will be times we'll see the same defendant's name listed more than once, and that's perfectly okay. The way we'll try to distinguish that is, let's see, there's another field that I didn't include here where you get to pick what the Kansas statute that they're being held under. So KSA 22-3302 or 3303, you'd indicate that on the form as well. That should make sense. And for still in the Senate Bill 228, you fill in the defendant's name, their case number, what county they're in, how they're ordered for competency, and then the next field is where the service was provided. And so here you'd select if they went to Larned or Osawatomie, or like the example here on the screen shows, if they were served by one of our vendors who works on behalf of Larned State Hospital, but their evaluation was completed in the jail through the mobile vendor. There's another option on the form as well for community mental health center, and we've started doing some agreements with community mental health centers to do some of the evaluation work directly in jails. So that's another possibility, but I think the most common are going to be Larned or Osawatomie as where the service is provided. Of course, the person's waiting, and you're just submitting for the month of July, and they've been waiting the whole month of July. That would go there's another option in that drop down that says they're still waiting for service. So it's just when you have that completed. And then it gets into the two dates we talked about. So the court order date is the date that the court has ordered them to either a 3302 evaluation or 3303 restoration. We think that's what you can identify on the court order itself as the start date. And then the end date is the date that they're admitted to Larned, that they've started receiving the service in the county jail, and that's completed, or when the mobile evaluation is completed and the report submitted to the court. Which is in this kind of second part of the slide text. So the service date, start date is when they're transported and admitted to Larned. So once they've left your jail, that's when you'd end it. Or they get the service in through a mobile vendor. It's when the evaluation has been completed and there's a transmittal letter sent to the court, and that again is something that would be date stamped, so it'd be easy to verify. Law enforcement or some of the sheriffs, as we talked to them, said they don't always know when the defendant's being released or when the court order or when the evaluation report's submitted. We're going to work on that to make sure that this is information that everybody in our little kind of network of providers now has. So we'll keep working on that. But again, those are things that we think are pretty readily available. So the form calculates the number of days between those two dates, adds it up for everybody that's submitted on the form, multiplies it by 100, and that's the dollar amount that we process. Because this is going to be kind of a recurring program, and you might have somebody who's waiting in jail for evaluation for more than a month or more than, our average is close to 300 days. So you could have somebody for a while, and you want to capture all of that time. If there isn't an end date and you still want to get reimbursed, you just put the end of the month, that the date for the end of the month in there, so we can calculate the number of days that they were in the jail that month. Tried to think of different ways to word that, but again, I think with some experience, you don't need to wait until the person goes to Larned to get reimbursed is the bottom line. If you want to get an interim reimbursement for the time that you've had them, we just need the date range needs to reflect that based on what you submit on the form. And that's perfectly fine. Can't be before they're actually in your care, can't be after they're discharged, but in the middle, I think we can work through a lot of the scenarios there. Oh, here's the legal authority. So on that form, we've got the, again, name, case number, county location, legal status. And so you can pick, there's a drop down in that column that's under KSA authority, legal status, that has all the statutory references and service provided by the things that are mentioned there. The LSH, Larned inpatient, Osawatomie State Hospital inpatient, waiting for services, mobile from LSH. And can answer some more questions about that if you got those. We may spell those out just so you don't have to remember the acronyms too. Let's see. So still on the Senate Bill 228 program. So because we can go back to July 1, 2022 for the whole prior 12-month period, which would have been the state's last fiscal year, what would be, I want to say it's easiest for us, but it seemed like it made sense to reimburse that prior period all at once and get that cleared out. So we're dealing with more current timeframes. So if we'd like to make one payment to each county for that whole 12-month period. So the way to do that would be to fill in the defendants' names on the form that were in your jail during that time period. Some may have been a resident of your jail before July 1. Some may continue to be after June 30, 2023. Again, that's okay. Just the start date for everybody's got to be July 1. And the end dates are, if you want to close out the year, you'd enter June 30. Or if you want to leave folks off until they're admitted to Larned, that's fine too. But we're trying to capture that 12-month period. If the legal, let's see. So you'd fill in the defendant's names and case numbers for everybody who is in that time period. If the legal authority changed, they did transition, they did got their evaluation was completed, but now you've got them because they're waiting for restoration. You can enter them twice for those different time periods. Again, if they're still in custody after June 30th, you could wait to enter that until they're admitted, or you could enter June 30th and close out the year and get reimbursed for those 365 days or whatever the time range was between July 1, 2022 and 2023. Again, we can't go back beyond July 1. So if you enter a date, because it's a form and you can fill it out, that's before that to reflect when you were originally court ordered, we're gonna move for calculation purposes the dates to July 1, 2022. And again, that's all information that we can verify against people that we admitted or are waiting for admission to Larned or Osawatomie. So there's this reimbursement part, which is, again, we want to clear as much of that out as we can before the first quarterly payments we'd start making for the July 1 to July, August, September 30 quarter. And get all, our goal is to get all of that historical retroactive payments made before the end of before this first quarter expires. So on the so if the other program, so the form will be a little bit different, but it has again a lot of the same elements. Have the individual's name, where they're being admitted from. These are for the care and treatment cases, where they were admitted. Again, just to give you a sense of the kind of information we're going to ask for on that form. There's got to be so we came up with or we're proposing, if you're holding somebody for a care and treatment case, and if it's law enforcement because they're in temporary custody or emergency custody until their case is resolved, that's what we want to reimburse for while they're waiting for that placement at the state hospital. We're suggesting, or what we've been talking about, is an hourly rate of $40 an hour as an inclusive cost for patient observation and other costs that you might incur or law enforcement might incur for that wait time. So to calculate at $40 an hour, we've got to have a start time, date and time, and ending date and time. And so we built the form around kind of entering a date field with hours, so we can calculate the difference. The beginning of those time periods would be when, and we're still working with the Hospital Association on what the beginning times would be, but the idea is it's when they're committed, ordered to the state hospital by the court on an involuntary commitment, and we've agreed to accept them. And sometimes that order date and the acceptance date are not the same because we could be waiting for medical clearance. There could be some other legal problem. So but we want that to be a field that we can agree on and clearly document through an established record, a date stamped court order, something like that. That's start time. End time is when they're admitted or transported to a state hospital or a state institutional alternative, and the timing of that. And then from the date and time, we can calculate number of hours and multiply that by 40, and then that becomes the payment amount. The program does also allow for reimbursement for transportation. And so we built a secondary form in this Excel spreadsheet that would let you submit or put in the cost to transport if you paid your ambulance service or prisoner transport, or maybe it's a law enforcement special rate, something like that. We'll reimburse the actual cost or the mileage to get to wherever the person went, Larned, Osawatomie, or one of the SIAs. That'll be a little clunkier and require some more documentation. But again, if you paid to transport somebody, you should have an invoice, or we'll know how many miles it is given where they started, which is pretty much all the things I just said here. Again, this is to capture the cost of the transport. If there's another staff observation or a staff member that was sent along with the transport to do observation or security, we can capture that on the other side in terms of the number from the dates and hours. But again, we want to capture the transportation. This is a little harder to figure out. So looking for suggestions, better ways to do it. Something that's still simple, simple and verifiable, either from a document that you all would submit or that we can go back and look at. Probably what's most relevant for counties is when law enforcement is engaged with somebody for an emergency commitment. Law enforcement can get involved and pick somebody up before they've been screened by the mental health center for state hospital admission, and they're not in criminal custody. But they are being held in protective custody while there's a medical assessment. Talked to law enforcement about this for a while, and their suggestion was that for that kind of case, the start time would be when a healthcare provider has been determined that the patient's a risk to themselves or others, which triggers that there's legal authority for law enforcement to continue holding them. And then at that point, the state hospital is notified of that medical determination. That's the start point. The end point is when they're then transferred to Larned, Osawatomie, state institutional alternative, or out of law enforcement custody. And we don't have to necessarily wait for the civil commitment process to be complete. That one, I tried to note here on the slide, that's going to require, I think, coordination between law enforcement and the healthcare provider, if it's local emergency department or critical access hospital, how that's happening, who's paying the transportation costs, who's holding them and observing them. We don't want to double pay. We want to pay the right provider that's doing the observation or that's observing that patient. I just don't know that we'll always know who that is. And we've heard lots of examples where law enforcement's sitting in the emergency room waiting for the exam to be complete. I think there's a reasonable question of who ought to get paid then. I would just assume not settle that. If you can work with local partnerships and figure out who wants to claim the reimbursement, we'll get through that. And maybe some will still be a little clunky and we'll have to figure out. But anyway, that in the nature of the issues that will come up, that was one that was pretty complicated and more than we've got resolved at this point. We'll probably get better at it as we see some examples. So there'll be these two forms, different programs, similar kinds of information we're asking for, pretty common things that law enforcement in counties deal with and other county entities might deal with. We'll have to keep it straight. We'll we'll certainly work with you to clarify if there's some questions. And it doesn't make it any easier that one of these programs goes back for a longer time frame than the other. So again, I appreciate your patience in letting me talk through both of them and kind of jumble it up, but we'll get there as we go through. The good part is the reimbursement on the payment side is the same for both of the programs. So when you figure out, we'll put the reimbursement forms on the website. Happy to send them to the Association of Counties too, so they can be a resource to distribute them as well. When you get the form filled out, without a lot of additional documentation, transportation may be the exception, you can submit that, email it to this email address, kdads.reimburse@ks.gov. You can just email it in. We'll take the Excel spreadsheet and take a look at it, verify names against people that we have at Larned or Osawatomie, or that we know their admission status, and just kind of spot check that. We are going to verify that you're enrolled in SMART, that the vendor ID is one that we recognize. If you're not, then get the information so that we can get you registered in SMART. That's the DA 130 is the form to get your SMART ID identified. And then the state needs a W-9, which helps identify your tax ID number and a couple of other things. So again, we'll put all those forms on the website. I just as soon not have everybody send those to us to process if we don't need to. So kind of, again, appreciate the opportunity to talk a little bit in advance of these forms being available, so you can spend some time verifying what your SMART vendor ID is before it's submitted. Again, we'll verify that everybody's in SMART so that we don't have a problem when we go to process the payment down the road. We'll verify what we can about care and treatment cases and admission status, all those kinds of things. We'll check the dollar amount, make sure it's right. And then we'll internally do an invoice for payment that'll say, so for Coffee County, Senate Bill 228 reimbursement for the month of July, well, it's supposed to be quarters, so July to September, we identified or verified $15,000. That's what we'll enter into SMART as a payment. And so when you get the ACH or check or whatever payment preference you have, I hope it has that reference number that you'll know this is $15,000 for reimbursement under Senate Bill 228 or the other program for care and treatment cases. We think if everything goes well and the dollar amount, we can verify the dollar amount, everybody's in SMART, or we can get that created from the date that we get a reimbursement form, we can get it paid within 30 days of that being submitted. And that's our statutory requirement, so that shouldn't be that hard to do. We've had really bad experience in the last couple of weeks of getting things paid at all. So we think 30 days is what we can reasonably expect. I want to go faster than that, and also not expect you to wait a full 30 days. If you get us the form by the middle of the month, we'll try to get it out before the end of the month. But 30 days is what we think is the time frame that we can definitely hit. So, and again, our goal is to get you one payment for each reimbursement request, and not necessarily identify every single defendant, every single patient that you held. It's for this county for a given time period under one of these programs. That's the information we're going to send to SMART to generate the checks. So where are all these forms and information? So we've placed it on the KDADS website. The picture on the left-hand side of the slide is our front page at kdads.ks.gov. There's lots of stuff there, very good stuff for counties to know about. But what's relevant to all of you is under state hospitals in the ribbon that's kind of in the center. If you click on just that state hospitals area, it'll bring up a page that looks like what's on the right-hand side of the screen. And again, you can go more into each individual state hospital if you want to. But we put on that landing page the information about these two reimbursement programs, a higher level summary than what I just did. We do have a slide presentation about the Senate Bill 228 reimbursement, and a video that I did for law enforcement, that if you want to I don't know why you'd want to listen to me talk about it for another hour, but if there's some part of it, seeing the form and how things fit together, you wanted to refresh your memory, that would be a useful thing for that. And then the forms are there. The Senate Bill 228 Excel spreadsheet's there. The DA 130 that is about smart registration, and then the W-9 form the state uses is on there as well. So that will be your kind of central location for the forms and instructions. We don't have any frequently asked questions yet. We're going to keep a list of those, and if we develop enough, that's where we'll put it. But you can find that all from the KDADS website. But again, also get the information to the association so they can have it to distribute to on request if that's not something that it is clear, but or you don't navigate to KDADS all the time, which makes a lot of sense. And then finally, that kdads.reimburse@ks.gov email address, use that for when you get forms ready to submit. If you've got questions that you want to ask, suggestions or things that would be clear, or just whatever comments that you have, it'd be great if you send them there to that kdads.reimburse email account. I monitor it. The staff member I've got that's working on this with me, Jason Yeakley, he monitors it. And actually, we've got 4 people that are watching it just to kind of keep track of what's going in there. But so we can respond from that one. But I've also put my email address and my phone number. It's not just Brunner. You have to put the Scott.Brunner. I apologize for that. But that's there, and my phone number if you've got a question. Feel free to email me directly. I'm happy to try to answer questions when we get into the processing of things. I'll probably refer you more often to Jason and the finance person on my team that's going to help us do some of the verification work as well. But I'm happy to answer questions, and oh, thanks Kim for doing that. Answer questions. Again, we haven't got it all figured out. I think we've got 80% of the kind of elements that we need identified. I think the individuals that you're going to ask for reimbursement for are pretty easy to identify. I mean, these are people that are in your care in the wrong place. The beginning dates and ending dates is what we need to kind of figure out how to identify. And again, I think we'll get there, and we can work on that going forward. But again, we'll figure out more as we go. But I think we've got a process that's workable, and we just need to. We'll appreciate your partnership going forward, and in the willingness of sharing information and trying to get the money out as quickly as we can. So that's my presentation. Let me go back to the Q&A. So there's a couple questions about juveniles in detention centers. I'm going to verify that for sure. There's one of the statutes that's mentioned on the forensic side for the Senate Bill 228 that I think overlaps with juveniles, so I need to check on that. The others are all related just to adult offenders. And we don't take kids at Larned or Osawatomie for forensic cases. So I will owe you an answer back on that, but I'm pretty sure the answer is going to be it won't apply to juvenile cases. Bob asked a question about juvenile or crisis intervention centers. That would be a county entity potentially that may be holding somebody for that's waiting for an involuntary commitment. I think some people were suggesting other places to look for the SMART information. Is there a preference on the timing of these reimbursement requests being sent to KDADS? Not really. I think the Senate Bill 228 talks about a quarterly process, which is fine. I don't think we have a strong preference one way or the other. If it's easier to do it by the month, or if you've got a backlog of them and quarterly makes sense, I think we'll try to be accommodating with whatever priority you want to submit them in. The one risk is if you've got somebody for a long, more than 180 days, we start bridging into months and we have to make sure we're not double or triple paying for the same person. I think the risk of that's fairly low, so I'm not too worried about it. But I guess I withhold the privilege to be wrong and change my mind about that sometime in the future. But right now I don't know to be worried about it. Can I list the quarters? Sure, that's a really good question. So on the form, the Senate Bill 228 form that has the quarters, early in our discussions with the Sheriff's Association, they said, well, not every county has the same fiscal year as the state. And that's a really good point. We don't want to be confusing. So on that form, we did list the quarters, but we assumed everybody's quarters are the same months: January, February, March, April, May, June, July, August, September, October through December. So those are the either calendar or fiscal quarters, doesn't really matter. You just pick the right year, and then that's how we'll match those up. With the smart IDB with the county treasurer, that's possible. That's what we heard from when we did the presentation for sheriffs, that they were either going to work with their treasurer's office or the county finance department, that they would be likely to know that information. So I'm happy to look it up for you upon request. If you drop me an email to either of those email boxes, I'm happy to do that. But I think it's presumptuous to ask, but I would say it's probably, if you don't have that, if you haven't asked your county treasurer or finance person if they know where they would like this money to show up in the county coffers, I would do that first. And then certainly if you don't get a good answer, or it's an answer you don't believe, I don't know if that would happen, or you're not certain, or they don't know, then certainly come back, and we may need to get you registered in SMART, and we've got some time, we can get that done before we have to process any payments. Don't see any other questions in the Q&A. But it's been a little while since I've used that function in Zoom, so I don't know if there are others that I'm missing.
No, Scott, you did cover all the questions that are currently in the Q&A. And I know that you did mention we were asked if we could share the presentation slides as well.
Oh, sure.
And so if I can get those from you. And we also were asked about this webinar was recorded. So they would actually have two opportunities to hear you talk about this subject.
I'm better dressed on this one than I was on the earlier one. So if you have a preference of attire, I guess I would watch this one. And I do apologize if it was confusing to mix the two programs, but I did want to cover both for this audience, because you may be involved in the forensic one or the care and treatment, or both. So I am trying to cover all the bases, but hopefully that wasn't overly confusing. I think it'll make sense when you see the forms that they're separate, but again, it's feel free to ask more questions as they come up.
Okay, well, I think I haven't seen any additional questions asked, and you did provide valuable contact information. So trust me, emails, when they're working, are great things to get answers to questions. So, oh wait, here we go. There's a question. Oh, nope, it's a thank you. Thank you for your presentation.
You're welcome. Thanks for the invitation and the thoughtfulness of asking for it. It's a great part of the effort is going to be getting this information out. We certainly don't want anybody to miss out on it. Not that it's a lot of money, but it's something that is for costs that counties have that don't have another payment source. So I'm not trying to find a way to I don't get to keep any of this money myself. So hopefully get the information shared so counties can participate, whether it's for one person or 15 or 20. It's all revenue that you as counties are supposed to get. So that's our goal.
Well, wonderful. Thank you again, Scott, for taking the time to detail this out. This was really great information. And I know that our counties will appreciate it. And I'm sure there will be questions, and again, those will be coming your way. So
sure,
we will include that contact information as well in what we send out. And then I know somebody had maybe mentioned if somewhere down the road to do another maybe refresher update or something like that. KAC is always willing to work with you to do that. So you'll know, I think, kind of from your end how things are going. And if you feel like you'd like to talk to the counties again, we'll be glad to set that up. And we just want to keep that information coming to the counties and
Sure.
for you to know too as well, what's going on. So we're here to all work together.
And even we put the Senate Bill 228 form out last Friday. That was our goal, and we made that. And we found a formula error or a suggestion that somebody made over the weekend about how they calculated days. So we've already made one update to that form on the website. So this is going to be a pretty dynamic process as we figure out better ways of doing things, getting questions in and trying to answer those. So again, appreciate the partnership and the willingness and the avenues to communicate as things change, so we keep everybody as up to date as we can.
Sounds good. I haven't seen any more questions pop up, so I think
Okay.
we'll go ahead and again, thank you, Scott, and we look forward to visiting with you. I know the counties will be, probably not so much us here at KAC, but you never know. We may be
Sure.
shooting you questions too, but we'll get all this information. We'll get the recording link, the presentation, the contact information, and we'll provide it probably to everybody that registered, as well as it will go in this Friday's e-newsletter that go out to all the Kansas County members. So I would say too, for the county folks, as you're dropping off or as you're still listening, be sure to share this to those within your county who you think this information would be valuable for. And again, be sure to get any questions that you have or any concerns or, just any general comments. Be sure to get them up to Scott and his team, because we know here at the KAC level, working with our state partners, they are fabulous. And we really appreciate everything you do for us and for the Kansas counties.
Sure. Appreciate that. Appreciate the partnership.
Thank you. And everyone, have a
Thank
great
you.
afternoon.
Yep.
And Scott, you as well. We'll talk soon.
Likewise. Take care. Thank you.
Take care. Bye-bye.